Now, the third class of the anti-anginal drugs are the calcium channel blockers. So they're classified into three groups. The first one is the phenylalkylamine, which include the verapamil. The second one is benzodiazepine, which include the diltiazem. Known as this is not the benzodiazepines. Those are sedatives and hypnotics. The third one is the dihydropyridines, which ends with dipines like nifedipine, amlodipine, isradipine, felodipine, and nimodipine. Coming to the mechanism of action of calcium channel blocker, as the name indicates, it will block the voltage sensitive calcium channels. There are five types of calcium channels like the L type, the T type, the N type, the R type, and the P type. These calcium channels will block the L type of calcium channels, which are mostly present on the heart plus vessels, and prevent the entry of the calcium current. So when there is a no calcium inside, there will be no excitation, contraction, coupling, and there will be relaxation. Coming to explanation of some of the calcium channel blocker, the first one is the verapamil, a very important drug, and it is cardioselective. It means that it mainly acts on the calcium channels of the heart. So it will decrease the heart rate by acting on the SA node. It will decrease the force of contraction. So by decreasing the heart rate and force of contraction, less oxygen will be required for the heart, which is our target. It will also cause coronary vasodilation, and the side effects are constipation. This one is very important for the MCQs. The next one is sinus bradycardia because it acts on the sinus node. The third one is headache because of its vasodilating effect, and the fourth one is AV block because it acts on the AV node. Note that beside the angina, verapamil also used for supraventricular tachycardia because of its action on the SA node and AV node. The second one is a diltiazem. Diltiazem has both peripheral and coronary action, means acts on peripheral vessel for vasodilation and also on coronary vessels. It also acts on the SA and AV node and thus decreases the heart rate and also the force of contraction. So the mechanism is same. So when the force of contraction and heart rate is low, then there will be less requirement of oxygen. It is also used in hypertension and supraventricular tachycardia. The side effects are headache, hypotension, bradycardia because of action on the SA and AV node, AV block, and edema. Edema occurs because they act on arterioles and arteriolar dilation occurs. So when the arterioles are dilated, then there is increase in the post capillary pressure, which increases the hydrostatic pressure and which increases the edema chances. The third group is dihydropyridines. They are potent arteriolodilators. So when they dilate the arterioles, there will be a decrease afterload. So decrease afterload, and there will be decrease work of the heart, and there will be less demand of oxygen. The side effects include hypotension, reflex tachycardia. Whenever there is arteriolo or venodilation, so there is reflex tachycardia as a compensation. There will be flushing, fatigue, dizziness, and sedation. Note that reflex tachycardia occurs, so it can be given in combination with beta blockers. Coming toward the fourth group of anti-anginal drug, which is the potassium channel openers. So the single drug here is nicorandil. The other drug are minoxidil and diazoxide. Minoxidil is used for baldness and diazoxide is used for hypertensive emergencies. Okay. The potassium channel opener like nicorandil is arteriolar and venodilator. So arteriolar dilator, it will decrease the afterload, and as a venodilator it will decrease the preload. decrease the work of the heart and decreases the oxygen demand. Okay, the mechanism of action is I have explained it already. The second mechanism of action is it also releases the NO, and through the cyclic GMP pathway it causes the vasodilation. The other drugs are antiplatelet drugs like aspirin and clopidogrel. Aspirin is used because it is an antiplatelet drug and will decrease the chances of thrombosis. If a person is allergic to aspirin, then clopidogrel can be used. Statins are used to decrease the thrombotic events. A very important and newer drug is ranolazine. It has two mechanisms of action. Number first, when there is ischemia, there is increased late inward current. So it basically acts on those channels and decreases the late inward current in the ischemic tissues. So when there is decrease the inward current, there will be decrease the potassium levels and decrease excitation contraction coupling, which will decrease the heart rate. The second one is basically the ischemic heart uses lots of fatty acid for energy purposes, and for fatty acid oxidation we need large amount of oxygen. So this ranolazine basically block the fatty acid oxidation and switch it to the glucose oxidation, which need less amount of oxygen and less consumption of oxygen will occur. The next one is trimetazidine. This also block the fatty acid oxidation as the same mechanism as discussed above. The fourth one is ivabradine. It acts on the SA node, so decreases the heart rate and the force of contraction and will decrease the oxygen demand. I will discuss a point here that these drugs are used in combination. Like we use the beta blockers with nitrates. We use the calcium channel blockers with beta blockers and nitrates for severe cases. Don't use nitrates with